Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, doctor of acupuncture, Chinese medicine herbalist, and founder director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Bianca Rodriguez, a holistic psychotherapist, Dr. Heath McAllister, a naturopathic doctor and a registered herbalist, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is post-COVID syndrome.
All right, I'm pretty excited because my aunt in New York City asked us this question. What are the long-term side effects of COVID? What do we know about that? So I'll let one of you guys take this.
So just to frame it, it is now a documented condition, even though I know some of my patients, their doctors have been kind of blown it off on them. But it can range from anything from the typical effects of COVID, like continuing fevers, cough, shortness of breath, fatigue, all those common symptoms, to furthermore things like brain fog, difficulty concentrating, exhaustion, muscle aches and pains, and then even more severe, a little bit more rare, but some documented effects can be inflammation of your heart muscle or even some kidney problems and more severe neurological problems besides just difficulty thinking, like even shakes and difficulty walking and weakness that goes beyond just fatigue. So it can range into a lot of different areas.
And what would be considered long-term? Is there like a cutoff point, like after your symptoms? I don't know, like how do you know when it's like COVID's done and now you're in that post-COVID time?
Yeah, so that's a good question. I think it varies, and I don't. If you did it, it's hard to do a test afterwards as well, because even when you've cleared the virus, you can sometimes be positive for a few months. CDC now considers if you've recovered from your fever and you're starting to improve from your symptoms in general, that within 24 hours of that you're considered no longer contagious or you're recovered. It can blend with long COVID syndrome where you just don't get better at all, or you start to get new symptoms, even though you're not. I mean, you've actually cleared the virus from your system, and it can last for months. Some people have it since last March, even so, going on close to a year at this point.
I think on average, people who have post-COVID syndrome, it lasts about 5 months, at least what I've recently read. And, it's different than a regular coronavirus, regular cold virus, because your regular cold doesn't linger that long on average. And there's just a greater number of people where that lingers much, much longer with the fatigue and the shortness of breath and a lot of other, potential symptoms that Dr. Rob talked about. But, I always think about what's going on inside the body. And really, like Dr. Rob said, after a certain time period, most of the viral load has been cleared, so you're not actively suffering from replicating virus. It's really your immune system, which has been ramped up, which is still very active, producing things like interleukins and cytokines, the things that make you feel achy and awful when you're sick. Those things are still happening and still at play. And so, how do you calm the body down? How do you help the body to heal? How do you help turn that corner? I don't think we really know yet. There's not a lot of evidence yet. There's some safe things that I think are easy to do, like certain supportive vitamins, like still vitamin C and vitamin D and zinc and things that are generally supportive of the body. Something that I have thought about that might be useful for this, but again, I don't have any evidence for it, would be something like NAC. NAC is the precursor amino acid in the synthesis of a molecule called glutathione. Glutathione is like the principal antioxidant of the body, and the lungs need a lot of glutathione when they're irritated. And so you could consider, just different supportive care like that to help shepherd you through, whether or not there's any, damage to your mitochondria or any deeper pathology. It's possible, but we just don't really have that information in terms of what damage has happened. I would be interested, Brendan, from your perspective, from a Chinese medicine perspective, like, is your Wei Qi damaged? Is your lung yin damaged? What is your feeling on what's happened in post-COVID syndrome?
Mm-hmm. I think it's a big topic, and I think it varies. There are probably multiple things that can happen from a Chinese medical perspective, someone who's had a various symptoms. But to start with, or to keep it simple, uh, certainly, the immune system, as you say, becomes overtaxed, or used in excess, or used beyond what you're normally used to. So when you're using up your immune system, or the energy related to the immune system, we speak about the spleen qi getting weak, or the lung qi getting weak. Between the spleen and the lung governs the immune system, and the spleen governing the immune system, and the lung governing the protective qi on the surface of the body, or the wei qi, or the protective qi. Um, you know, Between those two, I think the energy tends to get depleted, especially as time progresses. If you've had the symptoms for a short period of time, it's no big deal. It tends maybe just to affect just the chi level. But if you're having symptoms for several weeks or several months, then I think it will start to enter a deeper level of the yin level, or the blood level, where the system, the problem becomes more chronic. So I think, to keep it, this is kind of some general thoughts about it, but over time, the energy of the spleen gets depleted, and the energy of the lung gets depleted. And at first, it's just the chi level, so maybe the spleen chi or the lung chi, but in time, it might become, they typically don't call it the spleen yin, but they usually call it the stomach yin. It's the lining of the stomach, or the lining of the lung gets depleted. They call that the stomach yin, or the lung yin. And then what could also happen when it gets chronic is you start getting this empty heat. As the yin gets depleted, then you start getting more inflammation, but it's like a deficiency type inflammation. It's not inflammation because of an acute exposure, but it's because the exposure has been so long that it's kind of burned off the yin. You could think about it like a candle. The wax on a candle is required to, keep the wick lit. So if you burn the midnight oil, or you burn off that wax, that yin, then things burn out. So that can happen to the body as well. And so one can start, when they burn out, they start getting inflammatory issues. They start overheating, or getting inflammation throughout the body. It also can deplete the kidneys too. Yeah, I also want to throw in that comment, and the liver, as you say, Heath, that the liver can get taxed, and the kidney as well. So it's maybe 2, maybe 4 organs that first come to mind. But then you also hear about cardiovascular, so then also it's the heart. So now you've talked about 5, and now it's become not just 4, but 5 yin organs, and that's all 5 of them.
Yeah.
Oh,
So it's complicated.
And I always wonder, like, how the adrenals relate to Chinese medicine, but the sense I've gotten from the patients that I've seen is there's severe adrenal burnout. And it kind of makes sense to me that if you look at the 1917 flu pandemic and some of the autopsies they did, they found that patients' adrenal glands were literally bleeding. And so they were pumping out so much adrenal hormone to try to reduce the inflammation and give energy to the immune system, because the adrenals kind of help to fuel your body in that way, that they literally were bleeding. And so I think, in addition, again, the fuel to the immune system is the adrenals, and it may be just that. Again, the sense I got from the patients that I saw is they were just so exhausted from fighting the virus for various different reasons, that their adrenals haven't recovered. And that's another reason for aches and pains, is because if you just have low adrenal function, you're going to be achy. I also have sensed in those patients that when you really look back, they say I was healthy before and now I'm not healthy anymore. If you really start to dig deep, there were some issues that were going on before, typically, digestive issues, maybe food allergies, maybe some sleep issues and things like that. So on a positive note, I always frame that as, this is the silver lining, is that as you recover, you may be healthier than you've ever been if you really start to pay attention to those underlying issues in your health. And that's been kind of the, in my mind, and hopefully we can, as a nation, start talking about it more, that we need to pay attention to our vitamin D levels, as we've talked about on this show before, and our nutrition and just our health in general. And I think the trajectory of, my personal opinion is that the trajectory of this virus would have been completely different if we just had a better public health policy overall and just a healthier population.
Yeah.
Ooh, I am so glad you said that, because I needed that silver lining, because I was getting really down. I was like, oh my God, my anxiety is heightening. This is scary. But yes, I think one of the things I was going to ask was like, is there a certain segment of the population that's more vulnerable to having this post-COVID sort of syndrome or whatever it's called? And it sounds like if you had underlying stuff going on, that could be possible, but then that gives you the opportunity to look and go, well, let me remedy sort of this foundational stuff about my, my vessel, my wellness. So thanks for that, Dr. Rob.
And definitely people that have, what they call comorbidities or other conditions happening, they're the people that tend to die from COVID. And probably the people that, are maybe in the gray zone of pathology, where you might not have been diagnosed with something, but you're just not quite right. That, those people are also in a susceptible population. Like Dr. Rob said, you have food allergies, or you have seasonal allergies, or you have sleep disorders. I mean, any one of those are going to weaken what I call your vital reserve, which, you could consider your kidney chi, or, your pool of reserves that you have to recruit to fight off a virus or to rise to the occasion in any way. You could say it's your adrenal glands, you could say it's a lot of different things, but your vital reserve is going to be lower if you have one of these other conditionings siphoning off your vitality. So I do think it gives people an opportunity to look at all the leaks in their well and see, how can we preserve and conserve our vitality. And I will tell you, almost nobody sleeps enough, and everyone pretty much has kind of a junky diet. I mean, there's like easy low-lying fruit that you can intervene on to really help people cultivate that vital reserve.
Mm-hmm.
Great
That's
points.
visitors, Brendan.
What's that?
Time to get back to work. I said, you got some visitors. Time to get back to work, guys.
Well, that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thank you for joining us. And please join us next time for more wellness tips. Remember, regardless of where we are, our resources in The Well are limitless.